Hello guys, hope you all are doing really well. The topic for today's video is the ultrasound of fetal face abnormalities, which is a review from the book Requisites of Ultrasound. So in this image, you can see the normal nose and the lips of the fetus. The nose is indicated by the long arrow, the upper lip by the short arrow, and the lower lip by the arrowheads. Now this is the image of the fetus a bit later in gestation, and you can see the normal nose, upper lip and the lower lips indicated by the long arrow, the short arrow and the arrowhead respectively. Now this coronal image of the face reveals a defect in the upper lip indicated by the long arrows due to a unilateral cleft lip. The nose is indicated by the short arrow. The three-dimensional ultrasound confirms this finding, and you can see the cleft upper lip indicated by the black arrow. In this image, there is a unilateral cleft lip and a cleft palate. The coronal image of the nose and the lip reveals a large defect indicated by the long arrows in the upper lip and nose. The axial image of the same fetus reveals the defect extending through the palate, indicated by the long arrow. The 3D ultrasound of the same fetus confirms the finding. You can see a large defect in the face due to involvement of both the upper lip and the palate. Now let's talk about bilateral cleft lip and palate with premaxillary protrusion. In this sagittal image, you can see that there is a premaxillary protrusion indicated by the arrow due to bilateral cleft lip and palate. Axial image at an angle, and it confirms the bilateral facial clefts indicated by the arrows. This 2D image shows premaxillary protrusion indicated by the black arrow. This 3D image clearly shows the bilateral facial clefts with the arrowhead showing the premaxillary protrusion. Let's talk about hypotelorism. Hypotelorism is an abnormally small distance between the orbits. In this image, you can see that the orbits are near to each other, and hypotelorism can be measured by measuring the distance between the orbits and then comparing it with what is expected for that gestational age. Now this is the image of hypertelorism. It is an abnormally large distance between the orbits. Both hypotelorism and hypertelorism is seen in association with some underlying anomaly and syndromes, and so it requires a detailed antenatal scan if it is found. This is the image of microglossia, which is a large tongue, and as you can see in this image, it is preventing the closure of the lips indicated by the black arrow. It is most commonly associated with Beckwith-Weidman syndrome. Now this is a 2D image of microglossia. You can see the large tongue is indicated by the arrow, and the arrowheads indicate the mouth. Now this is the image of micronathia, which is a small chin. Micronathia is also associated with anomalies and syndromes. The arrow is indicating the small chin. Now this is a normal fetus with a normal chin for comparison to truly understand micronathia. So this sums up my video for today. Please subscribe to my channel, and inshallah I'll come up with more such interesting content. Thank you.